This video is based off of the before, during, and after hip replacement surgery booklet you have received from your surgeon. Information in this video can be referred to within the booklet. We strongly recommend for you to read the booklet and watch these supporting videos prior to visit and day of surgery.
My name is Desiree and I'm a physiotherapist at Brightshores Health Services. The total hip precautions include not bending your hip past 90 degrees. So in doing your exercises, making sure that your knee does not come towards your torso more than where it's directly above your hip. So that is 90 degrees there. Passing 90 degrees would be bringing your knee towards your hip, which you're not allowed to do for 6 weeks. Also, not to bring your leg, turning your leg in for 6 weeks, or bringing your leg in to the other side, such as when you cross your legs. In sitting, this also means not bringing your knee higher than your hip, so always sitting with your knees below your hips instead of bringing it up too far or bending too far forwards. Not crossing your legs again, as it will break your precautions. Standing, being careful not to pivot on your hip, because that would turn your leg in as well. Or if something fell on the ground, not to bend over and pick it up.
Hi, my name's Heather. I'm an occupational and physiotherapy assistant at Brightshores Health Services. Weight-bearing status. Following your surgery, you may have weight-bearing status restrictions from your surgeon. The physiotherapy staff will review this with you following your surgery.
This is a copy of the exercise board that will be posted on the wall inside of your hospital room after surgery. You can refer to this exercise board or find the information inside of your booklet.
Day of surgery after a total hip replacement, you'll be expected to start the following exercises. Pumping your ankle up and down once you're able to do so. 10 repetitions. Pressing your knee down and holding for a count of 10. And relaxing and repeating that twice an hour, and squeezing your buttocks together and holding for a count of 5 to 10 and relaxing. Repeated twice, once an hour. The first day after your total hip replacement, you will be seen by a physiotherapist or physiotherapy assistant for the following exercises, starting with ankle pumping, 10 repetitions, and then pressing your knee down into the bed and holding for a count of 10. And relax, and then tightening your buttocks and holding for a count of 10. Each exercise repeated 10 times. The next exercise involves turning your leg out to the side as far as you can, and then back to the center. Try not to turn your leg in, as this will break your hip precautions. Please repeat this 10 times. The next exercise involves bringing your heel towards your hip, sliding it along the bed to bend your hip up. Bending it as far as you can, holding for a moment, and then lowering slowly. Please repeat this 10 times. The next exercise involves sliding the leg out to the side. This will be difficult to do without the use of the strap, so it's recommended that you use your strap to do this. Slide your leg out as far as you can, keeping your toes pointing straight up and down, and then moving it back to the center. Repeating 10 times.
I'm Elizabeth, I'm a physiotherapist. I'm going to show you how to get back in and out of bed after you've had your hip surgery. You'll be laying in bed and you should have a pillow in between your knees in order to help you follow your hip precautions. Using your leg strap, you're going to move your legs over towards the side of the bed and move your bum. As your legs then move down over the side of the bed, you can lift up and bring yourself forward, being mindful not to bend too much past the 90-degree mark. Once you need to go back into bed, we put the pillow in between our legs, squeeze inwards, move our bum up the bed, and then squeeze in on the pillow, swing your legs in, and lay back down.
In this section, we will be reviewing transfers, how to get up and down properly after having surgery.
Once you're at the side of the bed, in order to get up safely with the walker, what you're going to do is leave your operated leg a little step forward. You're always going to push off the surface you're sitting on. Push yourself up and then grab hold of the walker. You can then bring your operated leg back and just balance the weight between your walker and your non-operated leg. In order to sit down again, what you do is place your operated leg forward, reach back for the surface you're sitting on, and then sit down again slowly. Do not pull up through the walker. This isn't considered safe at all.
In this section, we will show you walking, how to walk with your walker after surgery.
In order to move with your walker, you place the walker forward first, step your operated leg in, take weight down through your arms, and step your other leg forward. Walker, operated leg, non-operated leg, and again. We just continue this pattern in order to walk safely forward. If you need to walk backwards, you step your non-operated leg, your operated leg, and then your walker, and just repeat this pattern. This is how you can move safely forward and back. If you need to turn, you want to place your walker slightly forward, step into the walker again, slightly forward, and step into again. This is to make sure you don't twist or pivot on your operated leg.
In this section, we will be showing you stairs, how to go up and down them safely after surgery.
In order to go up the stairs after your surgery, if you have a railing, you use the railing and a crutch or a cane on the other side. We go up by stepping up first with our non-operated leg, followed by our operated leg, and then the crutch and cane. So non-operated leg, crutch and cane. And you just repeat this. This is going up with the good. When we come down with the bad. We turn, hold the railing, the crutch or cane goes down, the operated leg comes down, then the non-operated leg. And just do this pattern on each step. If you do not have a railing, you will need to use a set of crutches in order to go up and down the stairs. Place the crutches under your arms, and we use the same pattern we just used. Up with the good, down with the bad. We step up with our good leg, followed by our operated, and the crutches come behind. Just take your time, just so that you don't risk having a fall. When you're coming back down, you turn, step your crutches down, your operated leg, and then your non-operated leg follows.
My name is Jill. I'm an occupational therapist here at Grey Bruce Health Services. I'm going to be talking to you today a little bit about how to make things easier after your hip surgery. At your pre-surgical screening visit, your therapist will be measuring your seat height, just because when you bend too far forward, you're going to break that hip precaution of staying at 90 degrees at your hip. So one way we're going to do that is we're going to measure from the floor to just below your knee. And we'll give you that measurement to take home. And when you have that measurement, we want you to go and measure everything you're going to be sitting on at home to make sure it's the right height. If what you're sitting on is too low, what happens is your knees come up and your bottom goes down. So what that means is that you're breaking that hip precaution. So we want you to be sitting on something that's high enough for you. If the chair is sitting too low, then you can put a cushion underneath it so that you can, so that you can raise the seat up. Okay, and have a seat again. So this cushion is a wedge cushion where the back is higher than the front. This will allow your hips to be higher than your knees at all times. Another alternative to raising the seat with the cushion is to put blocks underneath your chair so that when you're sitting, you're at the right angle. I'm going to be talking to you a little bit about getting dressed. Just because you're not going to be able to bend down and put your pants, your socks, and your shoes on like you typically would. So I'm going to show you some easier ways to do things and some equipment that you'll be needing to pick up. The first thing we're going to do is work on putting on pants and underwear as well. So what you'll need is what's called a reacher, and I have one here. They come in different shapes, but this one has the handle that you can pull to release the end of it here.
It's a handy thing to have not only for getting dressed, but for picking up anything up off the floor, just because you'll be not allowed to bend down and pick up items there. It's also handy to reaching far away or reaching things up high, so that again, you're not reaching forward and breaking your hip angle. It's a good thing to maybe bring one to the hospital with you again, so if you've got blankets at the end of the bed that you want to pull up, you can use your reacher. So the first thing I'm going to show you is getting your pants on. So what you want to do is you want to get the leg that's had the operation dressed first. So let's say it's my right leg. I'm going to take the pant leg, bunch it up down towards the end of it. Okay, and then I'm going to use my reacher to hang on to that pant leg. Okay, then I'm going to bring it down to the floor, put my foot into the pant leg, and use my reacher then to pull up my pants. When it's about at my knees, I can then pull it up without the reacher so that my foot is all the way through. The other leg that hasn't had this surgery can bend any which way you want to. So if it can bend high enough to go into the pant leg, by all means you can do that. However, if that leg doesn't bend far enough, again, you'll need to use your reacher to put that pant leg in as well. And again, you can pull it up till it gets to about your knee and bring your foot through. Once you've got it up this high, you can then stand up and pull your pants up the rest of the way. To put on your socks, you'll need what's called a sock aid, and I have two different types here. One is already in a tube. This one just rolls up into a tube. Either one will work just fine. This is going to help you put your socks on, just because again, you're not going to be able to bend down and put them on normally like you would. So the way these work is that you take your sock, bunch it up down to the toes, and slip it over your tube. So you've got your heel down here and the top where your toes are, okay? You've got these nice long handles that you're going to hang on to. Drop your sock down to the floor, point your toe, slip your sock in, and pull slowly up on the sock aid. Now it doesn't come on all the way, okay? So once you've got that out of the way, you can then grab your reacher and pull your sock up the rest of the way. Okay, just like that. So now we're going to talk about putting on shoes. Shoes that slip on are going to be easier than shoes that tie up. It's okay to be using shoes that tie. Just remember, you're not going to be able to bend down and tie them up normally. So either tie them up ahead of time or use elastic shoelaces that will stretch out of the way and turn it into a slip-on shoe. Shoes that have a back, of course, will stay on easier, but you can use shoes that don't have a back, but just make sure that they're going to stay on your feet. Something like the Crocs and the Birkenstocks are okay, but something like the flip-flops for the beach are maybe not your best choice after a hip surgery. So to put on your shoes, we want to make sure we're using a long-handled shoehorn. Now this is an extra long one. You probably don't need one quite so long, but just making sure when you use it, you're not bending and bending too far forward at the hips. Okay? So the way this works is that you bring your shoe down to the floor and you use your reacher to line up your shoe and slip your foot in. Now, to stop it from bunching up around your heel, use your shoehorn to slip your foot in. We've talked about measuring the seat heights for everything just to make sure you're not bending too far forward at the hips after your hip surgery. So one other place you need to check the height is in your bathroom and checking the height of your toilet. So you want to measure from the floor to the top of this seat. If it's too short compared to what the number that the therapist gave you, you might need to put a raised toilet seat on top of the toilet that attaches right to the toilet bowl. Another option would be is a commode that has 4 legs that sits right over top of the toilet and raises the seat height up. The benefit of using a commode is that you can then put a pod in it, just like this, so that you can put it elsewhere in the house where you may not have access to a toilet. After your hip surgery, your surgeon's not going to want you to have a shower right away. But once you're allowed to have a shower, you're going to want to think about how you're going to be getting in and out of your shower. If you just have a walk-in shower, then you can walk right up to the ledge of the lip, step into the shower and continue on. But if you've got a bathtub, it's a little bit of a different thing. You won't be allowed to step over the edge of the bathtub for a couple of reasons. One is if you bring your knee up too high to get over the ledge, what ends up happening is your knee gets higher than your hip. So as you step over, that knee is too high. Then once you bring both legs in, at some point you're going to have to put all your weight on that leg that's had the surgery. So even if it's my right leg that's had the surgery, I lift it up, there's no weight on it. But as soon as I step down to bring my other leg in, I've put all my weight on that leg that's had the surgery. So you're going to use what's called a bath transfer bench to get into the tub, and that's what I've got here. What you're going to do with it is you're going to back up to it and you're going to sit down on it. Again, not bending too far forward, you're going to slowly sit down on the edge of it. From here you're going to scoop back a bit, lean back so you can bring your knees up and turn and bring them in over the edge of the tub, sliding over as you get in. Just remember, you're not going to be able to reach too far forward to turn the taps on, so you'll have to set the water up ahead of time. If you've got a handheld shower, that will work for you too. To get out, again, you're just going to lean back, bring your legs over the edge of the tub, scoot to the edge, do a turn, and then you're finished.
Following your hip surgery, your surgeon won't allow you to drive for 6 weeks following your surgery. It doesn't matter which leg you've had operated, the surgeons don't want you driving. If you need further instructions on this, don't be afraid to ask your surgeon about driving. So you're going to be getting in on the passenger side. You want to make sure you have a lot of room to get into the vehicle, so you want to move the seat all the way back and recline it as far back as it'll go to give yourself lots of space. You want to make sure you've got a cushion on the seat just so that it takes up the space, because oftentimes seats are bucketed in the vehicles. You then want to put a plastic bag or something that's slippery on top of the cushion so that it's easier when you get into the vehicle to slide in and turn you around. So you're going to back up to the seat of the vehicle, and you'll have somebody with you because you'll need a driver, so they can help out if you need it. What you're going to do then is reach behind you, reach for something to hang on to, reach for the door, and then you're going to slowly lower yourself down onto the seat. Once you're inside, then you can turn and lean back and then turn and get into the vehicle. So to get into a vehicle with a higher seat, you might need something to step up onto. So on my truck, I've got a running board to step onto, but if you don't have one of those, then you can use a step stool when stepping into the vehicle. Again, you want to back up to the seat and back up to your running board or your step stool. Then your leg that hasn't had the operation, your good leg, goes on to the running board, okay? And then you want to put your hands behind so you can hang on to something, push up, stand up, and then sit down, lean back and swing your legs in.
Before you come to hospital, please do the following. Review your exercises in advance before surgery. Leave walker, crutches, and cane at home. Follow your precautions for 6 weeks. And please feel free to review this video again.